Good afternoon, everyone. It's indeed a pleasure to see you here today. Looks like we have a full house and several other interested people in the gallery today. First order of business is we'll call the meeting to order. And at this point in time, Ms. Corbin, if you would, please call the roll.
Rhonda Allen. Dr. Andrea Anthony. Here. Doug Bodery. Here. Amber Brown. Here. Shay Crowell. Holly Deering. Here. Brian Gaither. Here. Mary Hickerson. Here. Lois Miller. Alan McAdoo. Jeff Phillips. Present. Shantae Sherrill. Here. Steve Spence. Here. Eric Tutobeni. In there. We have a quorum. We have a quorum, so we can take care of our business. First item on the agenda is approval of the minutes from the last meeting. Is there a motion? Have a motion from Barry, thank you. Is there a second? Have a second. Jeff Phillips. Any additions or corrections? Seeing none, all those in favor of approval of the minutes from the last meeting signify by saying aye. All opposed, motion carries. Next on the agenda is item number 2, our financials. Mr. Elam, Director Elam, you're recognized.
Good afternoon. The 264 fund for the month of December 2021, you have in revenue $9,158,726. Expenditures $6,936,969. Revenue exceeded expenditures by $2,221,757. For the calendar year, your revenue total is $86,442,013. Expenditures were $87,231,403. And your expenditures exceeded your revenues by $789,390. For the fiscal year, you have year-to-date $37,178,535. Expenditures $43,484,907. And year-to-date, your expenditures exceed your revenue by $6,306,372. The 266 fund for the month of December 2021, workers' comp, $11,735.39. OJI, $30,805.62, and for a total December 2021, $42,541.01. Year-to-date, workers' comp, $34,612.07. OJI, $256,080.88, and the total year-to-date, $290,692.95. Mr. Chairman, that concludes my report.
You've heard the report by Director Elam. Are there any questions? Seeing none. I have a motion from Chairman Pro Tem Phillips on a motion for approval of the report. Is there a second? Second. Thank you, Mary. Corbin, if you would, please call the roll.
Rhonda Allen.
Yes.
Dr. Andrea Anthony. Doug Bodery. Amber Brown. Shay Crowell. Holly Deering. Brian Gaither. Mary Hickerson. Okay. Jeff Phillips.
Yes.
Shantae Sherrill. Steve Spence. Eric Tutobeni. You have a quorum.
Motion passes. Next on the agenda is item number 3. Ms. Thompson is unable to be with us today due to a family matter, so Director Elam is going to cover for her. Director Elam, you're recognized on item number 3.
Yes, so the OSHA report for December 2021, you'll see that there was 14 incidences. Year-to-date, 174 incidences. OSHA log summary of total recordables is 128. Restricted day claims at 66. Lost day claims at 29. And other recordables at 33. On the next page, you'll see on-the-job injury claims. This year, 2021, you will see a year-to-date 174 compared to 159, 2020, and 268, 2019. Next page, on-the-job injury incurred dollars. Year-to-date, 2021, $523. 2022, you see $523,000, $815,000 for 2020, and for 2019, $493,000. And broken down, cause of injuries, you will see that total of Board of Ed had 10, County General had 4, County General, the Sheriff's Department had 2, CWC had 1, Solid Waste had 1. That concludes my report, Mr. Chairman.
Heard the report. Any additions or deletions? Do I have a motion? Have a motion to approve. And a second. All those in favor of approval of the report signify by saying aye. All opposed? Motion carries. Wellness update. Lee Smith.
I can do it.
Got it?
So, yeah, on the wellness program, you'll see 2022 year-to-date compared to 2021. The Motivate Me goal met for everyone is 629 2022 year-to-date compared to 749 2021 year-to-date.
Thank you. Next item is item number 5, MedPoint Report. Ms. O'Neill, Clinic Director. Hello.
Year 2020, the Stewart's Creek location saw 673 visits, but in the calendar year 2021, they saw 2,878 visits. And in calendar year 2020, the Walter Hill location saw 826 visits versus calendar year 2021, they saw 2,355. If you compare that over the year-over-year visit summary for 2020 versus 2021 in the overall totals, in September of 2020, we saw 563 visits. In September of 2021, we saw 1,371 visits. In October of 2020, we saw 1,095 visits. In 2021, 1,036. Do keep in mind that those October months did include the flu drives in both years. In November of 2020, we saw 657 visits. In 2021, we saw 882. And in December of 2020, we saw 711 visits, versus 2021, we saw 780 visits. So good overall trending rise for most months. In the unique member type by health center, we saw 145 children, 531 employees, and 104 spouses for the mixture for that 780 unique members. On page 6, for our visit appointment type, we had 124 members that had more than one visit in the month of December. 6 members had 4 visits, and 118 members had 2 to 3 visits. In the larger number of multiple visits, when I looked further into it, it looked like that was a mixture of care visits plus acute visits, or it was an acute issue that required multiple follow-ups, such as some COVID with some severe persisting symptoms and things like that. Another one with a severe head injury that required just multiple follow-ups to make sure we were taking care of them. In our appointment types, we had 45 annual visits in the month of December. We saw 19 dietitian visits. We had 514 of those established patient visits, which again could be anything from a medication renewal to the flu. We saw 34 new patients, had 66 nurse visits, 25 telephone visits, and 77 telehealth virtual visits that included the video component. In December, there were 23 available scheduling days. There were 5 Wednesdays, Thursdays, and 3 Fridays in the month of December. Monday was the busiest day of the month, and all of the health centers were closed on December 24th, December 25th, and the 31st in observance of the holidays. On page 8 for our virtual appointments, we had we had 102 virtual visits in the month of December. Walter Hill still continues to be the clinic with the highest average virtual visit utilization. Just over 20% of our visits were seen virtually in the month of December. Of those, 31.5% approximately were seen because they were sick, and a little over 68.5% were seen just because it was convenient for them. And since opening, we've had 13,063 visits. Of those, 2,373 were virtual visits, or just over 18% of our care has been provided virtually. In our referral summary, we had 67 referrals in the month of December. New Salem provided 31 of those, Stewart's Creek 24, and Walter Hill 12. Our dietitian remains the highest referral source for us at 11, with orthopedic surgery at 7 second, gastroenterology was 6 third, sleep medicine and psychiatry rounding off the top 5 there at 4 apiece. In our financials on page 12, in the month of December, there were 624 unique members, for a total operating cost of $149,967.80, a total employee count, including retirees, of 6,302, and a PEPM of $24. On page 14, for our diagnosis codes in our population health, you'll see that the encounter for general adult and child medical exam continues to be our highest diagnosis code utilized at 9.45%. Secondary to that was primary hypertension at 8.57%. Then you'll see we have quite a few sick care visits, kind of rounding off in the top there, which we haven't seen a lot of previously, but with it being flu season, COVID season, cold season, we're seeing some of that come up. So you'll see a sinusitis and pharyngitis, acute upper respiratory infection being in that top 5 there. Then continues on with anxiety disorder, then type 2 diabetes without complication. And down lower, the one that says contact with and expected exposure to, that is COVID. That's expected exposure to COVID. So that did make our top 10 diagnosis code list this month. In our visit demographic summary, in December, 70.47% of the members seen were female. The age range of 50 to 59 in the female and male population were the highest population seen, but there is a good range of ages throughout all of the ages, all the way from 10 to 89. You'll see, we had 79 people in the ages of 10 to 19, so definitely there's a good balance of different ages being seen in the clinics. On page 16, our BMI summary. The December female and male member highest percent of BMI was in the overweight category of 25 to 29.9. But again, you'll see kind of a good balance here in some of the lower numbers in the normal weight category, but then also up into the obese classes as well. So it's just kind of a wide range there. And that concludes my report.
Thank you, Ms. O'Neill. Are there any questions for Ms. O'Neill at this time? Seeing no questions, we thank you very much.
Thank you.
Have a great day.
You too.
Next, members, we have item number 6 on the agenda, the Cigna Medicare Advantage Plan. Mr. Huffman, Cigna. How are you today? Good.
Thank you. Good afternoon. So, if you recall, back in November, we gave you an overview of Medicare Advantage PPO and talked to you about the advantages of it, how we're able to duplicate the plan design, the network, lower the rate, and all that good stuff. And then last month in December, we provided you with an illustrative January 1st, 2023 quote for the entire county and Board of Ed combined, and the total savings that was associated with that. This month, I was asked to just come back here with a confirmation, if you will. There's a summary page, a PowerPoint document in your iPad that gives the same rate, assuming just the county. So we wanted to provide a quote if the Board of Ed were not included. The good news is there's no change in the rate. There's no change into what we quoted for the whole group. So we just wanted to provide you a savings exhibit here. If you'll look at this page over on the right, the rate that we're charging that we quoted last month, like I said, is not changing. It's $204.75 per member per month. That's compared to a funding rate that you're using. Right.
Paul, I don't think it's on their tablets.
I don't think it made it.
Isn't it? Okay. All right.
You have it?
Thank you.
Okay.
Sorry.
No problem. That's compared to the rate that you're using right now to fund the Medicare Advantage population of $606 per member per month. When we broke out, the Board of Ed excluded them. That left about 108 Rutherford County government Medicare retirees. So if that were a scenario, we could write that business with those 108 members at the same rate that we quoted for the entire group, which had roughly 650 or something like that members in the whole thing. So the savings, if you were to replace it just for the county, would be about $500,000 savings from that. I think if you'll recall, for the whole group, we were close to $2 or $3 million savings for the entire group. So that was kind of a preemptive information for you in the event that you needed to do a motion or a vote with the county, with the Board of Ed, or without the Board of Ed, just so you know that we have the same rate quoted for both scenarios. The other document on your iPad is a PDF document. I think it's about 10 pages. This just, what we assumed for this quote is a duplication of the plan design that you have today. So duplicating the medical plan design with 100% coinsurance, duplicating the pharmacy copays, duplicating the network, all the the behind-the-scenes stuff, that's what we assumed for this quote, and I didn't provide any other alternatives. Of course, if you did want to model something different, we could, but just for this purposes, that's what I wanted to bring. And that's about 10 pages that outlines those benefits if you want to take a look at those. Any questions about the Medicare Advantage PPO, either for the entire group or for County General by itself?
Questions? Ms. Nolan?
I don't know if you can answer this.
Try.
Why would I not want to do it?
There's not an answer. There's not a drawback. It provides a better benefit, equal or better benefit at a lower cost, and gives them even more resources than what they have now through Cigna.
Does it limit where the insured could go for services?
No, it does not. It is considered a passive PPO network, so they can go in-network or they can go out-of-network and receive the same benefit as long as a doctor, provider accepts Medicare anywhere in the country.
I'm
I
trying
know.
to be devil's advocate here.
Yeah.
Turn to our employees and we say, if we say we're not going to do this, I don't know what the justification is to say we would not want to do this because it's something different than what we've had before. The member gets the same service. And
Potentially better service, yeah.
better
Yeah.
than pick up some other. I can still go to the same doctors, whatever I'm used to, same hospitals, same care. The benefit of going on a OPEB, it's $600 is what the premium is now. And the employee is paying, let's say half,
Half of
$300.
it, yeah,
And the cost of this is even less than that.
even less.
So if we say, member, this is your cost, and the county does not participate in the cost, it eliminates our OPEB liability for group forward.
That's correct.
So it's like the calculation stops at Medicare eligible.
Right.
Doesn't eliminate the OPEB liability, all of it, because you still have that for the pre-65.
Pre-65, right.
That is, but there's an ending point. I don't have anything else to offer. I mean, I'm just trying to find out why we would not do it.
Well, I totally agree with you, Ms. Nolan, but I think probably in the next item, under item number 7, we'll probably talk about the elephant in the room, and we'll know a little bit better of why we're here. Mary?
Okay, a couple of little things is, pardon me. We know that if we go to this Medicare Advantage, that everybody would be eligible for the pharmacy, because we have a larger group now that's not of what's left of our 108. Even if DOE is included, it's still a larger group. So in a real quick glance, to me, it looks as if it's equal to or better than what they can have, and it's going to be exactly what the post-65s already have available if they were able to keep pharmacy, correct?
That's correct.
Okay. Then next question, got a couple, but the next question is, how would this affect a retiree going to one of our own site clinics?
No impact there. We can set up your on-site clinic. If your on-site clinic is still in place and you've got an increased benefit there, if it were to stay at 100% benefit, we can set that up in the same fashion for the Medicare Advantage PPO as well. Make that provider, enhanced, if you will.
Okay, because I know for a fact I have a post-65 retiree that goes to the clinics. That's their doctor. And then another thing is, and this is totally personal, my mother is on, she would be classified BOE retiree post-65. And my dad is on with her, and I mean, she's been retired for years. This $204.75 a piece, it's a piece.
Correct. It is per member per month.
Okay.
Correct.
And so that would be $409.50-ish, I think. Yeah. So if the county pays nothing towards it, if I'm remembering right, there's only a savings if it's just a retiree only, if the county pays nothing. Because if you've got a retiree plus spouse, got that additional cost when the county was picking up half of the.
No, I think they're paying the same. So every spouse is considered an enrollee or a member by themselves. So they are paying the $600 also right now, or the $300.
I'm going to tag onto that. What if, and I may be asking too far-fetched, but this is both people would be considered an individual, considering they both are 65 or older.
Correct. To be in this plan, they do have to both be Medicare eligible. They would both be enrolled individually. Yeah.
So in the situation, I know this is going to make it hairy, in those situations where one person's 65 and the other one's 62, they would just be under their pre-65 under different.
You would need to split the eligibility if you can do that, and put the Medicare eligible person on this plan and the other individual, even if it's a spouse, put it under the under 65 plan as their own record.
Till they reach Medicare Advantage eligibility.
Correct.
So that would be the same for anybody who potentially may be 65 and have a minor child,
Exactly, right.
that's still on their plan. So that would be the same. Okay.
Other questions for Paul? Okay, seeing none. Mary, go ahead. I saw you reaching.
If the county decides to go to this, are we moving everybody post-65? Is this going to be their only option? Will this be the only option for retirees, or will we keep some form or fashion of a pre-65 or?
That would be your decision. So the way we've quoted it doesn't matter. So if you decided to put this in as a full replacement as the only option, your rate's the same. If you decided to put it in as an additional option, the rate's the same. You're just going to get less savings. So our savings estimate is assuming full replacement. Yeah.
Other questions for Paul?
Can I ask a question real quick?
Sure.
Paul, this has been implemented in other counties recently?
Correct. The Nashville Metro government, they changed their code to require Medicare Advantage for all their Medicare eligible starting in January 1st, 2023. So Metro government is moving all their Medicare eligibles to Medicare Advantage January 1st. Metro Nashville Public Schools just implemented this particular same plan design January 1/1/22, so with Cigna. I believe Williamson County has also implemented this Medicare Advantage PPO. So yeah, there's a lot of traction with the government entities to look at this for the reasons that Lisa pointed out.
What was the date on Williamson County?
Actually, I think Williamson County has had it in place, I want to say during 2021. I don't know the effective date, but they had it. Yeah.
Our office deals with a lot of disruption. So can you give me some feedback on the ones that have implemented it and what issues they may have had or concerns or complaints?
Yeah, I may have to follow up with you on that. I don't have personal experience on that since Metro government hasn't done it yet, and Metro Nashville Schools just put it in 22 days ago or whatever. But yeah, I can see what has come back. The only thing I've ever heard is that someone might go see a provider that's out of network, even though we have the same benefits, and that provider, even though they accept Medicare, might not be willing to send a claim, and they ask the member to pay up front and fill out a claim form, okay? So that's kind of the worst case scenario. It would still be covered at the same benefit, but a member could find a rare instance where a provider requests them to fill out a claim form.
Is that it? Other questions? Seeing none, thank you, Paul.
Okay, thank you.
Members, well, that takes us down to item number 7 on the agenda. Mr. Brown from, I'm sorry. No. Brown, come forward and give us a presentation from Mercer. Okay.
Right, thank you, Mr. Mayor. So for those of you with the printed sheets and also the iPads, we're going to cover 3 things today. We're going to do an early 2023 projection. We're going to do some claim examples that Commissioner Allen had asked for, comparing the state plan and the Rutherford County plans. And then we're going to show an updated spreadsheet of the state level 1 rates. So if everybody will turn to actually the last page of the printed sheet, very last page. So this is the kind of the initial 2023 projection we said we would give in this meeting. Seen this several years in a row now, but if you look to the very far right, you're going to see for the rolling 12 claim period from January 2021 through December 2021, there's a total claim and pharmacy spend of $77,757,845. So that is our starting point. When we take out stop-loss credits and RX rebates, we get a new claims pick of $71 million. We have trended those forward. Again, we're projecting for 2023, so we're trending those forward. That gives us a new claims pick of $77 million. And if you'll remember, there's a $4 million adjustment here, and that is for the plan adjustments that we made that were put into place 22 days ago, right? So we actually don't have a single month of experience yet for all the changes we made. Local Plus network, moving to an HSA, all those plan designs that were put into place. So that accounts for, actuarially, that adjustment accounts for that. When you add in the fixed cost, so if you look at the line below, so we have the claims of $72 million, you add in the fixed cost of $6 million, we get a new projection of $80,873,911. That compared to the current budget of $78,206,000 gives us an initial 2023 projection of 3.4%. And that is making no plan changes at all whatsoever for 2023. That is just the projection as of today with the plans you have in place and the enrollment you have in place today. 3.4%. I'm going to stop there. Are there any questions on that? Again, we wanted an initial projection. I think we do this January, February. It's about the right time. So we're 11 months in advance, but we wanted to get that in your hands now. There's no questions. What I also wanted to show you is exactly what Mr. Huffman just spoke of. So if you'll go back one page, this is a projection run the same way, but taking into account if every post-65 retiree was enrolled in the Medicare Advantage plan. Due to the savings of that plan, if you look to the very far right, the new projection would be 1.4%. So the savings generated out of the Medicare Advantage plan takes right at 2% off the overall budget. So for 2023, if you made no plan changes whatsoever, other than allowing the post-65 retirees to enroll in the Medicare Advantage plan, we would project a 1.4% renewal increase for 2023. That's the first thing we wanted to show you today. Any questions?
Doug?
On your first page, you're showing a across the board increase of 3.4%. That's what you're projecting, your initial projection.
Correct.
I noticed though you're having what factors in, you have a for your HSA, you got the 12.1% increase you're projecting.
Correct.
Well, increase the 12.1 for the increase for the HSA increase. Then you have an increase of your copay that went up 9%. For this current year, you're going to have another 3.2% increase that you're projecting for the copay plan. I noticed the next column, it's got the deductible plan. You're factoring in a drop of a 12%, but this committee already voted to get rid of that plan.
And so we have to base this on the claims period that we're looking at, which is 2021. That deductible plan was in place when these claims were incurred. But we actually don't have a single bit of data on the claims that were put into place 22 days ago. So what we're doing is doing our best to project, literally 2 years into the future almost. So to your point, Doug, we think this will look, as far as each individual plan, might look a little different next month when we have actual claims data from the HSA plan and the copay plan. Of course, we have voted that the deductible plan would go away. The overall increase we think will be the same, 3.4. We actually think that might go down some because of trend, but this is the best we can do based on not actually having a single month of claims for the plans and the networks. Remember, that was a big piece of it that we put into place, 8-9 months ago, or decided 8-9 months ago.
And the large decrease for the post-65, that's taking into account the thought that it would go to the Medicare Advantage.
Correct.
Okay.
Good call out. Yes, sir. So that's where we stand today. Good question.
Other questions?
Okay. The second thing we wanted to cover, if you go to the very first page, this is going to, if you're on the iPad, it's going to be called the State Plan Compare Level 1 Rates. So if you remember last meeting, we showed you a spreadsheet that had the Board of Education. It was in a blue box, and if you're on the iPad, it's still blue. The County General was in orange, and then green kind of tally that up. And these are the current 2022 rates for both our plan and the state of Tennessee plans. And I'm going to pause for a second. I know, Mr. Elam, you called me maybe a couple days ago. The state has lowered the County General rates from level 2 to level 1. I know you had a phone call with them. Any maybe reasoning, or was there a reason why they lowered it before I present this, or is it anybody's interested?
No, they just said they recalculated it, there was an error, and then we came to level 1.
So state recalculated.
It could have been after my phone call to Lori Lee.
What?
Could have been after my phone call to Lori Lee.
And after the phone call to Lori Lee? That's so there was a recalculation.
Well, I asked her, I said, why can't we be in level 1?
Yeah.
And instead of level 2.
Yeah.
And I think they went back and looked at it, and when I got the email, or the email from her assistant, they came back, which was good. Doug, you remember me, Doug? You remember when I sent that to you? Where the state came back and said that we could qualify under level 1?
Yes, sir. I really appreciate you, reaching out to the state. I mean, obviously that happened. Something
you never know
happened
until you
there.
ask,
Sir.
But that really helps us on getting that level 1 rate. Otherwise, I don't know what we'd do staying at level 2. Barry?
Quick question. A little small snippet of the difference of level 1 and 2, please. And then, if I heard you right, Mayor, we actually have this in writing that we're level 1 now?
She sent me the text. That still doesn't mean it'll happen. Oh, I got something, and then they're going, oh, well, she no longer works here,
So what we wanted to update is, over the last couple of days, those have now been updated to level 1 from level 2. So no plan changes, nothing on the spreadsheet changes other than the county general rates, which is the middle box. Virtually every plan financially now does see a savings by moving to the state now that you're in the level 1 bucket.
And what are those savings?
So if you look at the bottom, the savings, so the Board of Education box did not change any. The middle box, the orange box, the county general now could save somewhere between $866,000 all the way up to $3.3 million, depending on which plans at the state employees enrolled in. The last meeting, I believe there were several plans on the county general that were actually not a saving. So because of level 1, now every plan virtually does look better financially than the Rutherford County rates as they stand today.
Well, the reason Lori Lee told me that we had been level 2 is because most of our general fund employees are older compared to BOE. Most of them are younger, childbearing. However, more diseases come with our age population. That's why they had us in level 2. But I think they realize that we're healthy in level in Rutherford County, so they put us in level 1.
Any other questions on that? Okay. So the last thing we wanted to show was several claim examples comparing our plans to the state plan or the state plans to our plans using the deductibles, plan design, co-insurance, out-of-pocket. How does it stack up? And I think Commissioner Allen said, in a layman term, what happens if I go to the doctor? How much do I actually owe? So the SBCs, or Summary of Benefits and Coverage, they are regulated nationally, and lucky for us that both entities publish these or are required to publish these, so we can actually compare 3 real-life claim examples, and they can be compared exactly how those plans are written. So if you have your iPad, the first one I want to look at is the state standard plan, and that's at the bottom. So that is the plan that's their second richest PPO. We're going to compare that to our OAP plan. And if you go to page 7, for those of you following along, this gives an example of Peg is having a baby, Joe has type 2 diabetes, and Mia has a simple fracture. And in the middle of that page, you'll see Peg's having a baby, total example cost is $12,700. And at the top, you'll see that the state plan has a $1,000 deductible, $50 specialist copay, a 20% hospital facility coinsurance, and other coinsurance of 20%. In this example, Peg would pay $1,000 for the deductible, $40 in copayments, $1,800 in coinsurance, for a total of $2,900 in that example. So I wrote that down. I want you to remember that number, $2,900, is what Peg would have in this scenario. And we're going to look at the exact same scenario under Rutherford County's plan here in a second. The middle one, Joe has diabetes. Their example there is $5,600. You can see the deductible of $800, co-payments of $1,100, co-insurance of $20, for a total that Joe would pay in this scenario of $1,940. Finally, Mia's example, a $2,800 simple fracture, taking into account deductibles, co-payments, and co-insurance. The total Mia would pay is $1,500. So for those of you on the iPad, if you want to go back, we have the exact same breakdown, and it's going to be called RCOAP, so Rutherford County OAP. And if you open that and go to page 8, again, you will see the same examples. So Peg is having a baby again. Peg's going to spend $12,700. When you take into account our deductible, our copay, and our coinsurance, Peg's total would be $3,460 versus, I believe, $2,900 for the state plan. So in that situation, and typically it's because of the deductible is lower in the state standard plan than our deductible is, that $500 is captured there. Look at Joe's example. Joe would spend $5,600 on diabetes. And this is where I find it interesting. So $0 deductible, $600 in co-payments, 0 in co-insurance. Joe would pay $620. And if you remember, the state, I believe, was $1,940, and the question is, why is it less in this example? Your plan, as it's set up today, pays lab and diagnostic services at 100% without meeting the deductible. That's a benefit y'all put in years ago. So in this example, in this specific example, when lab and diagnostics are taken into consideration, Joe would actually pay, almost $1,300 less on the Rutherford County plan. This is why, Commissioner Allen, I'm glad you asked for these examples, because this gets away from just showing what the deductible and co-insurance is and actually gets down into how the plan pays. So then look at me as example. $2,800 deductible, $980, copayment $600. Me would pay $1,580 on this plan versus $1,500 on the state. So $80 more on the Rutherford County plan. But what we wanted to show was, number one, the examples that were, you asked for some examples. I thought that was good. The plans do pay similarly, but there are things that are different, things that have been put into place over the last few years to benefit employees. So we just wanted to highlight those. You can go through the state on the iPad. We have the SBCs for every state PPO plan. We have the SBCs for the HSA, our HSA, so we can do the comparison. And in every SBC, it looks just like this. There's a PEG, a Joe, and a Mia example.
Mr. Chairman, I have a follow-up question.
Yes, Commissioner Allen.
Thank you. So to see the full picture, though, you need to know how much they pay in premiums as well.
Right.
So how does the premium compare when you factor in their total cost?
So I know what our premiums are. Unfortunately, or fortunately, you get to determine what your premiums are going to be under the state plans. So we have no way of knowing what would be charged for the plans. That is an agency decision. The state gives you the total rates, which we've always been looking at, right? That total billed rate. And then each agency gets to determine, so like we have a plan that's $24 a month. You get to pick based on what your budget is. So it's difficult to compare because we don't know what that would be under the state plan. Again, the way I understand it, the state gives you the plan designs, they give you the total budgeted rate, which is what this front page kind of gets at, and then you get to pick your HSA contribution, which we have chosen ourselves, I think $500 and $1,000. You get to pick what comes out of employees' paychecks, whether you do some sort of a wellness program, you get to kind of customize that piece of it. And I will say, what I also can't compare is we know that these are the 2022 rates for us and the 2022 rates for the state. We know that the projection I gave at the beginning, with one more month of data, it's not, if we get one more month of claims experience and we implement the Medicare Advantage, a 0 or 1% increase is not off the table for us, which is good, but I don't know what the state's going to be. I'm not even sure when their timing is, but I can't really give a fair comparison on 2023 because I don't know what the state's going to be yet.
Doug.
I guess one thing we could do is look at the last 8 years, the comparison between the two plans, the state and the rate increases. That would be probably pretty accurate to see past performance of rate increases to the local governments. Correct? I mean, that's one way to look at it. I mean, there could be a year that one would go up, but if we look at consistency, I'm thinking for budget purposes, not just for the county, but also our employees' household budgets. We could see the comparison where the state had, 2-3 years of no increases in the last 8 years handed down to LEAs.
Yeah.
I was just thinking that would mean something to me looking from the budget.
I agree. Yeah.
We know that. Averages over that period, do you know that off?
3 to 4, I think, is their average over that period. And they had some that were 0s and some 5s, and yeah, they had a low increase. And what our goal was last year was to maybe try to implement some of those tools like the HSA, like that narrow network that the state offers to maybe get on the same path as them. But you're right, they've had low single digits for many years.
The other comparison, you could do is say, if we kept our rates static, How much of an increase would the state have to do for us to be even?
Very large for us to be even.
For us to be even, if we kept our rates the same and say, okay, state, if they do anything below whatever the magic percentage is, it's a gain for the
Yeah, I mean, so every percent, so if we kept our static and every percent increase is roughly $750,000. So they would probably have to increase 7, 8, 9, maybe even closer to 10%, with us staying at zero to close the several $1,000,000 gap, or make it where it's at least debatable.
And with this fund, our internal service fund for the health plans, our health plans having an actual $2 million loss. I mean, obviously, last fiscal year per audit. I mean, we have to take that into account. Obviously, we're going to make sure our fund stays sufficient in fund balance and operations. So, I mean, I know projections are projections, but also at the end of the day, if we stay with the county, we have to make sure the money's there to pay the bills for our employees and retirees. That obviously is going to factor into that increase.
Sonia.
I may be remembering this incorrectly, so I apologize in advance if I am. But it was my understanding, part of the reason why the state's rates have stayed so level or balanced, going up 0 to whatever percent, is because they were drawing down their fund where they had overcharged in the past. So the last, 6, 8 years, the lower rates were as a result of a larger fund balance, I don't know how else to say it, in that. And so they passed those savings along to the employees based on what the fund needed, based on a meeting that I watched that the state held. That was a public meeting. Am I understanding that right?
There was I believe actually their most recent report that's out there, and one of the meetings, I believe in the report they said something along the lines of their average or their annual trend is roughly 6%, but due to the ability to draw down from their reserve fund, they have capped it at zeros and I think 2s and 3s, depending on which party you're in. But yeah, there was a report that stated something along the lines of 6%, but so they had the benefit of using some of those reserves.
So do we know what their reserve fund currently is and what that trend would do? Like if they've drawn down the reserve fund and they have to keep it at a certain fund balance, they say, okay, the fund balance in this account needs to be at 10% or whatever, and they draw that down. Do we know what impact that would have on their premiums for the employer and employees? Or
I would want somebody from the state to answer that, but it's a fair question.
In my conversation with Ms. Lee last week, she was hesitant to come out with anything at this point. In my conversation with her, however, she did say because of their claims, because of COVID, she's expecting anywhere from 8 to 10% increase on the state plan. So we can't continue supplementing out of their ending fund balance from the state to supplement the plan. So the rates have got to go up for Tier 1. She said that, of course, so my question was, well, can we come along if the BOE decides to come on, and you've all made a presentation, can we come on board with them? Yes, the answer was, but we can't come in the same plan because of, it's in code that boards of education are considered in one, and we can't go into that. However, I was pleased that we're now in level 1 instead of level 2. So they're expecting for 23 anywhere between 8 and 10% increase on the rates.
Is that for each, like, would that be the rates for, like, the Board of Ed, like you said, it has this, I don't know what the name of that fund is it state educators or LEA, is that what it's called, the plan for the insurance, is that right, LEA? And then the county, is she saying the 8 to 10%, for local governments and 8 to 10% for the LEAs as well, or is it just for counties?
That's correct. And she said that if we were to go to the state, if our county general went to the state, we would be probably the largest county in that plan statewide. And a lot of the smaller counties wouldn't like us in there because their smaller counties would be supplementing our losses, if that makes sense. That makes sense. But I said, I've got to look at total dollars saved, you know.
That was part of the risk we were concerned. I mean, you said that gap's like 8 to 10%. That's the first we've heard about this potential increase, but that does close that gap some to something.
Well, I think we would be prudent, maybe wait until next month until you got data that we could actually get our mind around. What do you think, Director?
I agree. There's just a lot of moving pieces.
Lisa?
I was curious. I think, Ed, you said that the state did not set their rates until May.
I believe the meeting was May 27th of 2021, if I'm not mistaken, is when they set their rates.
23.
And it was aggregate rate was 6.2, and they used ending fund balance to get it down to 3 point something.
I was thinking years ago, the state was setting their rates that they should be and drawing down their balances by giving premium holidays, meaning this is what the rate should be. We're not going to charge or collect for this month.
Right.
Draws down their cash balances, but keeps the rate like it's supposed to be. I don't know what that change.
Like Mayor Kittredge said, I did also ask for a 12-month trend to see where they were. I didn't get it. I'm still trying to get it, but to give us an idea of what their trend is over the last 12 months also.
The part of my question, I got off topic, is timelines. At what point is it we've got to decide for your office to then react to this change?
Yes. Well, to back you up a little bit, it goes into effect January 1, 2023. Annual enrollment is October. Communications seem to be trying to get everything done is going to be like July. And
short window.
It's a very short window trying to decide. And then when you got trying to make projections in order to get to the commissions, to get your projections voted on and approved, normally it's March, April when we present those.
Finalize, right, go through the council.
I think this committee may see it in March, then the full commissions and budget sees it in April, if I'm not mistaken.
So next month, if we have some more data for the February meeting, right?
Yes.
Should have a better idea.
Yes.
Still gives us a little bit of time to work into March, 1st of April
Yes,
for our budget
that's
purposes.
what I'm thinking is that March rates that, we start building budgets on that with the expectation it should not be more than.
Right.
If whatever choices we make, if we stay or we go, hopefully if we choose to go, it's because the rates are lower, our budgets will accommodate. That's what I'm thinking.
Yes.
Right. In all fairness, we have, the data that we have is very, very small to try to project rates for 2023 when you've only got a few weeks worth of data that's come in. I mean, it's just, it all happens very fast.
Another month or two will help us because we get to see, usually January, February, March are lower months because the employees are paying a big part of that deductible. So, it should help the overall increase a little bit. That's how, you remember last year, this time we had a 15. We ended up at a 8. And now we're at a 3.41 if we do the others. It will go down a little bit as we get a couple more months of data.
Sonia.
Thinking too also not just about like our active employee rates, our decision also will have to be what does this body that will then request to the commission for our retirees? What does that look like? I mean, I understand, you know, that is a big piece of the pie. I mean, are we going to say that we're going to maintain insurance at the county? Let's just say, for example, county and Board of Ed decided to make the decision to go to the state, right? Well, that's the active employees. What does that mean that we keep a plan here at the county for the retirees that are already retired? And I'm talking pre-65 at this point, because you got a post-65, which is totally different. Don't you have to have that information don't you have to have the whole enchilada to be able?
I think the county commission would want to do that because we've always done it in the past. I'm not sure that they want to swallow that pill at this point, like the state did back in 2015. They just walked away, told everybody, pre and post 65 retirees, you're on your own. You know, you're on, if you qualify for Medicare, there you go. I think that we would have to come back with some type of supplement, but I think you'll see in the savings, you know, just the school board between $8 and $9 million savings. The county can pay for the supplemental.
Are you talking about, do you see the savings because they would not be, I don't understand where the savings would come from the retirees. You mean to the plan, it would be a savings?
Because if the BOE went to the state, the savings there, what they say, Doug, between $8 and $9 million? Okay, it's the savings. So that savings, you would take that. The commission would take some of that, whatever the cost may be, to pay for what we're currently paying for.
I haven't followed you. Okay, I'm following you.
Okay. And so it may net out a $7 million savings compared to 8 or 9. I don't know.
So the potential is, if I'm understanding what you're saying, is it may be that whatever, regardless of whatever we do with the active employees, we may be not addressing any of the retiree stuff until a future date, so as not to cause so much disruption to services and stuff. Is that maybe is what I'm?
Yeah.
Okay.
I would think so.
Because I know we had talked about the GASB is what I'll call it, their bucket list of who falls into what bucket, and we had talked about potentially revisiting that if we didn't go to a Medicare Advantage type plan for the post-65, because you still got your pre-65s. And so I'm just thinking in the overall cost savings, you know, we might be saving money in one place, but it may be causing an increase in money or a reduced benefit in another, and we just need to be aware of what that was. And I think our commission needs, you know, you as the mayor and the commission needs to be aware of, you know, what kind of phone calls or communications they may receive from that. So,
Ms. Allen.
Yeah, I want to follow up with that. The phone calls that I have been receiving are from folks who are worried about losing their prescription coverage. That's their big concern in going to the state. So I really want to have the full picture of where are we saving, where are we spending, you know, how's it all going to shake out before we make any decisions, because when there is a ripple effect, the last thing you want are unintended consequences. You thought you were getting one thing, made a decision, thought it was good, oops, you know, now we've harmed somebody else unintentionally. So this touches everybody, active, pre-65, post-65, it's the whole picture, right? So I just want to make sure that as we make this decision, we've analyzed every single piece of the puzzle and then decided, okay, across the board, we're going to put together a trust or a supplement to make these people whole, right? So they're not going to move backwards. I just want to make sure we've got that whole plan in place before we make any decisions. And I've continued, the phone calls that I've got have a lot been from folks who are retired from the BOE, and I've reminded them the Board of Education can make this decision on their own, that it is not up to this body to decide. So if they lose prescription coverage with that change, that's, you know, that's something I would still like to help us figure out. How do we make them whole, even if we do nothing on the county general side? Because you never want, again, employees, active, retired, whatever, to move backwards, right? If we can afford to help keep them whole, then let's do our best to keep them whole. But I just want to know where are all the buckets, where's all the money coming from, where's the savings, where's the spending, and where's the coverage, right? I think it's important that we just look at the whole landscape.
Well, I'm saying we need that data for next month. That we might be able to make that a better decision, so you all can come to us at that point in time. I don't think we'll be able to walk away. I don't think our retirees will let us walk away with them not being attended to, and they understand what we're doing. But I don't think we're going to take anything away from them at this point in time. Now, what I did say to some others is that if the BOE votes, the board votes, and they decide to go and they save $7 or $8 or $9 million and go, then I'm sure the county commission is going to want to go, okay, so we'll just take $8 or $9 million off of what you're asking for your total budget for that savings. But we'll work through this. We're going to take care of all the employees.
And that's one of the questions, too, that I always have in terms of specifically with our Board of Education budget, which is maintenance of effort. So how would a sudden savings like that, I don't know how that would affect maintenance of effort at all. Could we take that money and do something different with it? I don't know.
We'll let Ms. Nolan, if she's still here, find that out for us. Doug?
Is that working?
Miss Anthony? Give Doug one that works.
How's that?
That's good.
Awesome. Thanks. We've had that discussion on the 7 million, 7-8 million savings. The thought would be, of course, we could allow spouses to be back on the plans for our employees. The other item was we have numerous employees like our custodians, our EAs, our school secretaries, that they are on the HSA plans because that's the only plan they can afford under the county plan. If they had rates that could open up, that they could afford a better plan, some of them are having health issues that they really don't need to be on a high deductible plan. They need to be on a better paying plan. I noticed that we talked about the limited PPO that the state has. They created that just for local government employees. State employees can't even get on that, I don't believe, unless they've changed that recently. That was tailored for that lower income secretary, custodian, that could then, if they had health problems, they could then move up to a better plan. And of course if they do that would of course increase the side what the county was paying on that premium. So that you could see that savings mitigate. Plus, if we had increases, once again, the state has had consistent years beating the county for what actually got handed down to the LEA for the last 8 years, with 2 or 3 years of zero. That savings could absorb a increase, whereas what I'm looking at right now with the preliminary, that's probably close to $2 million that I'm only putting in the BOE budget for health insurance. I would assume, if based on these preliminary projections, that's 2 cents on the tax levy. So that, to answer your question, that's what the savings would go to, plus the thought of, that would be, okay, we're not asking for more revenue, we're trying to hold the line with expenditures. And on the flip side, as we've discussed, more networks, lower premiums for our employees, avoid asking for additional funds for the increase, and also serve as a recruitment tool, because we would then be, our BOE employees would then be on the same health plans as virtually every district, every LEA, almost to pretty much every district from here down to the Alabama line, excluding Hamilton County, and then all the way to the east is pretty much all those LEAs all the way, and then including Knox County, which is larger school system than Rutherford. So that really opens up really good recruitment tool for HR.
Mary?
Okay, we've got a lot of what ifs and who is and coming back next month, and that all sounds good and fine. But if we come back next month and we still don't have an answer if BOE is leaving or not, then we're back to what if and who is and where are we at now? Do we have a line, and for lack of a better term, has BOE actually decided they're leaving? I know there was communication with teachers that if anything happened, it'd be January of 2023. And so, I mean, we can beat this dead horse, but if next month we still don't know if BOE is leaving, we still don't know what we need to do for the rest of the county, you know, because that is a large population. We need to, if we're going to look at the whole picture, we got to look at the whole picture of who's here. Is BOE in or out? And if they're out, then we need to look and see what it does for the rest of the lives of the people for the county general, and look at it. Do we move? Do we not move? We need an answer, and we can't keep on and on and on. And if BOE is still up in the air, then let's take time for everybody, BOE, county general, everybody, to look at this and make a decision for 24 when we've got a lot more answers on the plan. And Doug is speaking to, you know, having the spouses where they can come back on it. But I thought, and I could be wrong, the spouses can be on the state plan if they don't have insurance capability somewhere else, but there's still a penalty that they can be on it, but you're paying additional if the spouse could have it elsewhere. That didn't sound right. But anyway, so we need to figure out that to be able to come in with some numbers and some answers, we need to know who's in and out. And then my next question is, for Paul, I know his number is good with or without BOE, but how long is it good? If it takes us a couple months to decide whether we're doing on our retirees the medical advantage or not, I mean, because that sounds like a wonderful, great plan, and I can't find anything wrong with it yet. I keep looking. But we just need some more hard answers so that when the numbers come back, it is apples to apples, because who's in and who's out.
I think at our next meeting, Mary, we'll have a pretty good idea where we're at, which is February the 24th. Go ahead and mark your calendars for that on February 24th. So it'll be a big meeting. 24th, I think the board, the BOE will, I think they're kind of there anyway, but I think they'll have a better idea to their commitment and what direction they're going, which will put pressure back on the general fund. And we need also that short window to be able to go to the county commission and share with them what our options are. Other comments? Everybody good? All good? Okay. Thank you for your presentation, guys. We appreciate that. And is there any other business to come before us today? Remember, our next meeting will be February 24th here at 1 o'clock. So make sure you don't get COVID or anything. We need you here. Stay safe. Is there a motion to adjourn? Motion to adjourn. Second. We're adjourned.